Catheter inspection and preparation. The AccuNav catheter has been cleared by the U.S. FDA for intracardiac and intraluminal visualization of cardiac and great vessel anatomy and physiology, as well as visualization of other devices and for the measurement of blood flow. The AccuNav catheter is a sterile, single-use 10 French ultrasound catheter designed to obtain images of the entire heart while placed inside the venous system. Depending on the ultrasound system you have purchased, you will be able to operate the catheter at up to 4 different frequencies. At the lowest imaging frequency, the AccuNav catheter typically provides ultrasound images down to 15 centimeters in the heart. The catheter contains a 64-element ultrasound transducer that produces a 90-degree longitudinal image format. The catheter tip steers in 4 directions, left-right and anterior-posterior, to allow for micro-positioning of the ultrasound catheter and subsequent steering of the imaging plane toward the target of interest. Each plane is controlled by a separate knob and can be steered in each direction. With the catheter in the neutral position, the active scan surface of the catheter faces anterior and is positioned along the longitudinal axis. The tension control knob provides graduated tension to the steering mechanism to hold the tip of the catheter in the desired position. Catheter inspection. Before using the AccuNav catheter, visually inspect the catheter, evaluate the performance of the steering and tension control knobs. Using sterile technique, run your gloved fingers along the entire surface of the catheter, inspecting for any signs of mechanical damage. Hold the catheter body in one hand and turn the posterior-anterior steering knob clockwise to steer the tip in the anterior direction. Then turn it counterclockwise to steer it in the posterior direction. Now turn the left-right steering knob clockwise to steer the catheter tip to the right, and then turn it counterclockwise to steer it to the left. The knobs should move freely without binding, and the catheter tip should flex in the direction toward which the knob was steered. To straighten the tip of the catheter, turn the steering knobs so that the neutral position ridges are aligned. To evaluate the tension control knob, increase the resistance by turning the knob clockwise, then steer the catheter in any direction. An increase in resistance of the catheter steering should now be noted when using the steering knobs. To decrease the resistance, turn it counterclockwise, and then steer the catheter in any direction. A decrease in resistance of the catheter steering should now be noted. If the catheter does not perform each of these test functions as described, do not use the catheter. Inspecting the SwiftLink catheter connector. The SwiftLink catheter connector is a reusable cable that connects the AccuNav catheter to the ultrasound system. Before connecting the SwiftLink connector to the ultrasound system, run your fingers along the entire surface of the handle, cable, and system connector, inspecting for any signs of mechanical damage. Ensure that the handle lever and the locking mechanism operate smoothly. If any part of the connector appears to be damaged, do not use it. The SwiftLink connector is reusable with disinfection only. Do not sterilize it, as most sterilization techniques will cause damage to the internal parts. When disinfecting the SwiftLink connector, ensure that disinfection fluids do not enter the handle lever or locking mechanism, as this may also cause damage to the internal parts. Applying the sterile cover. Applying the sterile sheath requires 2 people, one within the sterile field to prepare the catheter, and the other outside of the sterile field that will connect the AccuNav catheter to the SwiftLink connector. The person within the sterile field holds the ultrasound catheter by the handle and slides the unrolled end of the sterile sheath over the interconnect tab and the base of the catheter. The rolled end of the sheath should rest on the base of the catheter, leaving the interconnect tab exposed. Fasten the unrolled tip of the sterile sheath to the catheter extender near the base of the catheter handle. Be sure the sterile sheath is away from the interconnect tab so that the tab is exposed. The person outside of the sterile field holds the SwiftLink connector adjacent to the sterile field with a lever on the top end of the SwiftLink raised. The interconnect tab on the base of the catheter is inserted into the slot on the SwiftLink connector by the person within the sterile field. The person outside of the sterile field pushes the SwiftLink connector until it is flush with the edge of the ultrasound catheter and lowers the lever until it is locked and flush with the handle. Use the tabs on the sheath to roll it down over the SwiftLink connector cable. Connecting the SwiftLink connector to the ultrasound system. To attach the SwiftLink connector to the ultrasound system, insert the system connector into one of the active transducer ports on the front panel of your ultrasound system. If using an Acuson Aspen or Sequoia ultrasound system, the SwiftLink should be inserted with the cable coming out of the top of the connector. If using an Acuson Cypress ultrasound system, the connector should be inserted into the connector port located on the right-hand side of the system with the cable down. A person outside the sterile field must operate the controls of the ultrasound system unless the system control board is covered with a clear, sterile drape. With the sterile sheath now in place and the SwiftLink connector connected to the ultrasound system and to the catheter, verify that the catheter is imaging before inserting it into the patient. After the ultrasound system is turned on, unfreeze the image on the screen by pressing the Freeze Run button. Using sterile technique, place the tip of the catheter in a container of sterile saline and use the tip of the catheter to move the saline solution around in the bowl. You should be able to detect movement on the screen while the saline solution is moving. Should the catheter or SwiftLink connector not perform as expected during the pre-procedure inspection process, please contact your Siemens Medical Solutions Uptime Service Center. Insertion of the AcuNav catheter. Before advancing or withdrawing the catheter, always ensure that the tip of the catheter is straight and that the tension control knob is set at low tension so that the tip of the catheter can move freely. Insert the tip of the catheter into the venous introducer with the neutral position ridges on the two steering knobs aligned with one another and facing up. Do not use excessive force to advance or withdraw the catheter. Fluoroscopic guidance may be helpful in advancing, steering, and withdrawing the catheter. Either the left or right femoral veins or the internal jugular vein are typically used for insertion of the AcuNav catheter. A physician trained in cardiac catheterization should determine the optimal insertion point.